Have you ever wondered how an IV line is inserted? It might seem like a simple task, but it's a process that requires precision, skill, and a keen focus on patient safety. Let's dive in. The first step in the process is the introduction and preparation. Understanding the importance of IV therapy and the necessity of proper technique is crucial. It's all about ensuring patient safety and minimizing pain and discomfort. First, check to verify the doctor's order and the type and size of IV catheter needed. Depends of the type of surgery or procedure. Select the appropriate size of IV gauges. Then gathering all necessary supplies like the IV catheter, sterile dressing, chlorhexidine, IV tubing, and IV solution is also part of this first stage. Next, it's time for hand hygiene. Remember, washing hands thoroughly is a must before any invasive procedure. The third step involves patient assessment. For scheduled surgery cases, typical IV will be on the left hand. It is more desirable to anesthesia providers. It's also when you evaluate suitable veins for IV insertion, considering factors like size, visibility, and condition. Avoid insertion on the side of the patient who has recently undergone breast surgery or hemodialysis access. After assessing the patient, it's time for patient education. The procedure should be communicated to the patient in detail, explaining each step. Next, the equipment is prepared. This involves opening the IV catheter packaging while ensuring sterility and setting up the IV tubing and solution according to the doctor's order. The sixth step is vein selection and site preparation. Choose an appropriate vein that is readily accessible, visible, avoid joints to prevent impediments during patient movement. Then, cleanse the selected site with a chlorhexidine swab in a circular motion, starting from the center and moving outward. Then, the vein is stabilized. A tourniquet is gently applied proximal to the insertion site to make the vein more visible. The vein is then anchored using the non-dominant hand, pulling the skin taut. Next, the IV catheter is inserted. Holding the catheter at a 30-degree angle to the skin, it's inserted into the vein with a smooth, controlled motion. Once in the vein, a steady, brisk blood return confirms proper placement. The catheter is then advanced a short distance into the vein while maintaining a stable position. Using your non-dominant hand press, down on top of the catheter tip. Retract the needle, release the tourniquet, connect the IV tubing, and open the roller clamp. Visually observe drips in the chamber. The catheter then is secured using tape or a securement device, and a sterile dressing is placed over the site, ensuring it is secure and covers the insertion site adequately. The 10th step involves post-procedure assessment and documentation. Monitor the patient for signs of complications, such as swelling, pain, or signs of infiltration. Record the details of the IV insertion, including date, time, catheter size, and any relevant observations. The patient is then educated about post-procedure care and encouraged to report any signs of complications. Finally, post-procedure care involves safely disposing of used sharps and contaminated materials, and of course, another round of thorough hand washing. So there you have it. Inserting an IV line is a complex process that requires attention to detail, patient safety, and proper technique. But with these steps, it becomes a manageable task that can be performed safely and effectively. The more you practice, the better you become. The key is, do not be discouraged when you miss. Keep trying and seek out expert in your unit for help. If you find this video helpful, please share, like, and subscribe. Thank you for your support. Until next time, take care.